Hello, I'm Susie Grieshop, Early Intervention Program Nurse with the Montgomery County Board of Developmental Disability Services, a human services levy-funded agency, and I'm here today to talk to you about NAS. NAS is Neonatal Abstinence Syndrome. It is a group of condition caused when a baby withdraws from certain drugs he or she is exposed to in the womb. Most often, these are opioids. Drugs pass through the placenta and affect the fetus. Babies' livers are not functioning in utero and not fully functioning after birth, so the drugs are poorly and slowly metabolized. Common drugs that are seen in this syndrome are heroin, codeine, morphine, oxycodone, fentanyl, carfentanil, methadone, Suboxone, but they also include other drugs like cocaine, antidepressants, and benzodiazepines, also known as sleeping pills. NAS is diagnosed by maternal history, either knowing or suspecting drug use in the mother, a urine test at birth, both the mother and the baby. They can also check meconium, which can give them a long-term drug history. Most hospitals test all delivering moms. Dayton Children's tests all admitted newborns. Symptoms usually appear within the first 72 hours after birth, but could be as long as a week for some drugs before they appear. Symptoms can last a week to 6 months. Every baby is unique. Their signs and symptoms depend on multiple factors, things like how long the drug use went on, how much was taken, was there polydrug use, which means multiple drugs being used, and whether or not the baby was premature. Signs and symptoms of NAS include tremors, twitching, seizures, tight muscles, fussiness, excessive crying, poor feeding, slow weight gain, sweating, diarrhea, difficulty sleeping, excessive sneezing, and a continuous runny nose. Treatment includes comfort measures, pharmacological intervention, sometimes both, sometimes none. They are all based on a Finnegan scale that hospitals administer to the babies in the hospital to check their signs and symptoms for NAS. Intervention includes morphine, which is the most commonly used drug. It's given in tapered doses to wean the baby off of the heroin. Methadone can also be used. Phenobarbital or clonidine can be used. These are usually added if symptoms are severe. Babies are typically discharged home 72 hours after the last dose of the pharmacological intervention. Things you can do to comfort these babies. Sometimes they need IV hydration because of poor feeding, vomiting, and diarrhea. They can get a special high-calorie formula to give them those increased calories. There's also something called the 5 S's, which includes swaddling, side-lying, shushing, swinging, and sucking. A low stimulus environment has proven to be helpful. Skin-to-skin contact, or what's also known as kangaroo care. Breastfeeding if the mother is on methadone. And then special skin ointments because they tend to get really bad diaper rashes and skin breakdown. NAS is a qualifying diagnosis for early intervention in the state of Ohio. Help Me Grow referral will begin the process of early intervention services. The developmental pediatrician can also be used for follow-up care, other specialists based on complications, and private therapies. How does this affect them? The effects on the development in infancy include sleeping difficulties, feeding difficulties, poor growth, they're unable to self-soothe, and skin breakdown. Birth to 3 years can have a wide variety of developmental problems. They can have speech and feeding delays, gross motor delays, which are due to positioning in utero, behavioral problems, or global delays. Also, based on the environment, these children can also be at increased risk for abuse and neglect, like I said, because of the environment, but also because they can be difficult babies to care for. Early intervention is key with these babies, and we usually see them very, very soon after they've gotten out of the hospital. So if you know of a family or you would like to refer a family, the referral process starts with Help Me Grow. If you would like more information on NAS, please feel free to reach out to me. I can be reached at 937-238-8136 or by email at sgrieshop@mcbdds.org. That's SGRIESHOP @mcbdds.org. Thank you.